Welcome to the deep dive. Today, we're focusing on something small but, well, really powerful, your thyroid gland.
That's right. And specifically, how a simple blood test can unlock some major insights into your health.
Yeah, we're digging into guidance from our source material over at Blood Test UK.
It's fascinating, this little gland, shaped like a butterfly, right there at the base of your neck.
Most people probably don't give it a second thought.
Not until things go a bit wrong, yeah. But its hormones, the T3 and T4, they're basically controlling the speed of, well, everything in your body. Your engine speed, kind of.
So if T3 and T4 are the speed dials, what about TSH? That's the thyroid stimulating hormone, right?
Exactly. TSH comes from the pituitary gland in your brain. It's like the message saying, okay, thyroid, speed up, or time to slow down a bit.
Got it. And it's critical because if that whole system gets out of whack...
Oh, the symptoms can really knock you down. Take hypothyroidism, that's when it's running too slow, not enough T3 and T4.
Right, like the engine's cold.
Precisely. You feel constantly tired, maybe gain weight without trying, feel cold, just generally sluggish.
And the opposite, hyperthyroidism. That sounds just as bad.
It is. That's the engine revving way too high. Think anxiety, heart racing, can't sleep, maybe losing weight unexpectedly.
So that fatigue people feel, or those mood swings, this test could actually find the reason.
Often, yes. That's the core benefit here, early detection. These things often creep up slowly.
So finding it early means you can get treatment faster and feel better sooner?
That's the key. It really is the first step towards getting things back on track.
Okay, let's talk practicalities. Getting a test itself, the one that measures TSH, T3, and T4. Sounds simple.
It generally is, yeah.
Yeah.
Just a standard blood draw, usually from your arm. A phlebotomist does it.
Quick, minimally invasive.
Right. But the information you get back, that's huge.
And knowing those levels, that gives you control, doesn't it?
Absolutely. If everything's normal, great. Peace of mind. If something's off, you finally know why you might be feeling run down or anxious. You have a target.
Now, preparation. This sometimes trips people up. What do you need to do beforehand for accurate results?
Good question. The main thing is usually fasting. So no food for about 8 to 12 hours before the test.
Just water is okay, though.
Oh yes, definitely drink water. Being hydrated makes the blood draw easier, and, well, it's just good practice.
Okay, and what about pills or vitamins?
Really important point.
Yeah.
You absolutely need to tell the doctor or the person taking your blood about everything you're taking.
Like supplements, medications, anything.
Yes, because some things can temporarily affect your hormone levels and skew the results. So transparency is key.
Makes sense. Now, thinking locally, say if you're in or near Middlesbrough, what are the options for getting this done?
Right, good example. Your first stop is often your GP, your family doctor. That's the standard NHS route.
And the sources mention specific places, too.
They did. James Cook University Hospital came up, known for, really comprehensive care. That's a solid public option.
Okay. And if maybe you need results faster or prefer to go private?
There are private clinics, too. The Tees Valley Diagnostic Center was mentioned as an example for that. Often quicker, more direct.
So basically, you've got the public route, like James Cook, and private options like Tees Valley. Good to know there are choices, depending on what works for you.
Exactly. You want to check what's available in your own area using these sort of models.
Okay, let's sort of wrap this up. We've seen this thyroid check isn't just another test. It's pretty fundamental for your energy, your mood, your overall vitality.
It really is. It helps pinpoint the problem so you can start fixing it.
And if the results aren't normal, what happens then?
Your doctor will explain what the TSH, T3, T4 numbers mean. Usually treatment involves medication to balance things out, maybe some lifestyle adjustments too.
And it's not just a one-off test if you have a condition, right?
No, definitely not. Regular follow-up is crucial. Generally, testing every 6 to 12 months helps make sure your treatment is working and your levels stay stable. Keeps you feeling well long-term.
Right. It's about staying on top of it. Okay, so final thought for everyone listening. We know this simple test can make a huge difference between feeling constantly tired or having energy.
A massive difference.
So knowing that this proactive step is available, what's maybe one simple thing you could do this week just to check in on your own well-being? Something to think about.